Welcome to Nutrition and Health, a course designed for Ethiopian medical students. Today, we'll synthesize and summarize key concepts from foundational science to national policy, focusing on how nutrition impacts health outcomes in Ethiopia. The journey begins with understanding the basics, then moves through epidemiology, interventions, and finally, policy and future roles. Let's explore how each piece fits together, preparing you to make a meaningful difference in your clinical encounters and beyond. Nutrition is the science of how our bodies ingest, digest, absorb, transport, utilize, and excrete food substances. Understanding these processes is essential for medical practice. Macronutrients, carbohydrates, proteins, and fats provide energy and structural components, while micronutrients like vitamins and minerals are vital for metabolic function. The mid-upper arm circumference, MUAC, is a key screening tool for acute malnutrition in Ethiopian health posts. Clinical signs of micronutrient deficiencies, such as night blindness or goiter, are crucial for diagnosis. Limitations exist in nutritional assessment, including BMI's unreliability in certain conditions and the confounding effects of inflammation on biochemical markers. Assessing malnutrition involves tools like MUAC and identifying clinical signs such as bilateral pitting edema, which is diagnostic for severe acute malnutrition, SAM. MUAC thresholds help classify nutritional status. Less than 115 indicates SAM, 115-124 suggests moderate acute malnutrition, MAM, and 125 or more is normal. Edema can override MUAC or weight in diagnosis. Recognizing micronutrient deficiencies, like vitamin A causing night blindness or iron deficiency leading to pallor, is vital. However, assessment tools have limitations. BMI is invalid in cases of edema, ascites, or pregnancy, and biochemical markers may be affected by inflammation. Epidemiology reveals the scope of malnutrition in Ethiopia. Stunting affects about 40% of children under 5, while wasting impacts 5% nationally. Concurrent wasting and stunting, known as WASINT, increases mortality risk exponentially. Regional variations are significant, with Amhara, Oromia, Sidama, and Central Ethiopia facing high malnutrition rates. The intergenerational cycle perpetuates malnutrition from mother to child and beyond. Ethiopia faces a triple burden: undernutrition, micronutrient deficiencies, and emerging overnutrition. The economic cost is staggering, with child malnutrition costing the country billions annually and affecting national productivity. Micronutrient deficiencies are a public health concern in Ethiopia. Vitamin A deficiency affects 61% of children under 5. Iron deficiency anemia impacts 17% of women and 22% of children. And iodine deficiency causes goiter in nearly 36% of women of reproductive age. Folate and vitamin B12 deficiencies are also prevalent, especially among pregnant women and in specific regions like Oromia. Addressing these deficiencies is critical for improving health outcomes, reducing mortality, and breaking the cycle of malnutrition. Effective interventions require targeted supplementation and education, particularly for vulnerable groups. Community-based management of acute malnutrition, CMAM, is a cornerstone intervention. It includes inpatient care at stabilization centers, outpatient care through OTP, supplementary feeding, and community outreach. Triage determines the appropriate management. Children passing the appetite test and without complications are managed outpatient, while those with severe edema or complications require inpatient care. Ready-to-use therapeutic food, RUTF, such as plumpinut, is dosed by weight and provides essential calories. The WHO 10-step protocol guides SAM management, ensuring standardized care across facilities. The Seqota Declaration represents Ethiopia's commitment to ending stunting in children under 2 by 2030. This ambitious initiative unfolds in 3 phases: innovation, 2016-2020, expansion, 2021-2025, and scale-up, 2026-2030, covering hundreds of districts and aiming for nationwide implementation. The declaration drives policy, resource allocation, and accountability, ensuring that nutrition interventions reach those most in need. It is a model for sustained, coordinated action against malnutrition, with the goal of zero stunting within a generation. Nutritional anthropology examines how culture shapes dietary practices in Ethiopia. Orthodox Christian fasting, which exceeds 200 days per year, influences the intake of pregnant and lactating women. Intentional food restriction during pregnancy is sometimes practiced to limit fetal size, driven by concerns about obstructed labor. Intra-household feeding order, where husbands are served first, contributes to maternal and child undernutrition. Understanding these cultural factors is essential for designing effective interventions and counseling patients with sensitivity. Food security is built on four pillars: availability, access, utilization, and stability. These pillars determine whether individuals and communities can consistently obtain nutritious food. Ethiopia faces a current food security crisis, with millions projected to experience acute food insecurity by mid-2026. Addressing food security requires coordinated efforts across agriculture, health, and policy sectors, ensuring that vulnerable populations are protected from hunger and malnutrition. Food safety is a critical concern in Ethiopia. High-risk foods include raw milk, which can transmit brucellosis and bovine tuberculosis; raw meat dishes like kitfo and tire siga, which carry risks of Taenia saginata and Toxoplasma gondii; contaminated water, leading to cholera and diarrheal diseases; and maize and groundnuts, which may be contaminated with aflatoxin. Chronic aflatoxin exposure causes liver cancer, immune suppression, and childhood stunting, especially when combined with hepatitis B infection. Mandatory food fortification is a major public health advance in Ethiopia. Wheat flour is fortified with B-complex vitamins and zinc, edible oil with vitamins A and D, and salt with iodine and folic acid. The Salt Fortification Program, launched in January 2026, is a world first. These policies are enforced by the Ethiopian Food and Drug Authority, EFDA, ensuring that essential micronutrients reach the population and prevent deficiencies. Fortification is a cost-effective strategy to improve national health. Ethiopia's first food and nutrition policy was launched in March 2026. This policy establishes the Food and Nutrition Council, ensures budget allocation, and increases accountability for nutrition outcomes. The National Food Safety Master Plan, 2025-2029, aims to protect public health and strengthen Ethiopia's position in international trade. Ethiopia has also made 15 commitments at the N4G Paris 2025 summit, aligning national strategies with global goals to be attained by 2030. For every child under 5, clinicians should measure and record MUAC, assess for bilateral pitting edema, plot weight and height on WHO growth charts, inquire about breastfeeding status, ask about vitamin A supplementation and deworming history, and check for recent illnesses. Nutritional status should be classified as normal, MAM, or SAM, and referrals made according to national protocols. This systematic approach ensures early detection and management of malnutrition, improving child health outcomes. Pregnant women, clinicians should calculate BMI or MUAC, check conjunctivae for pallor to screen for anemia, inquire about iron and folic acid supplementation, assess dietary diversity and fasting practices, counsel on healthy diets, and screen for food taboos. Addressing these issues with cultural sensitivity is crucial. Proper nutrition during pregnancy supports maternal health and fetal development, reducing risks of complications and malnutrition. For patients with diarrhea, clinicians should assess hydration status, prescribe oral rehydration solution ORS, prescribe zinc supplementation for children, advise continued feeding, and counsel on hand hygiene and safe water. These steps help prevent complications, support recovery, and reduce the risk of further malnutrition. Continued feeding and proper hydration are especially important for young children. For patients with chronic diseases such as TB, HIV, or liver disease, clinicians should assess nutritional status using BMI, MUAC, and albumin if available. Screening for micronutrient deficiencies and providing nutritional counseling and supplementation are essential. Monitoring for refeeding syndrome when initiating nutritional support is also important. These steps help manage disease progression and improve patient outcomes. Ethiopia has made remarkable progress in reducing malnutrition over the past 2 decades. Stunting rates have dropped from 58% in 2000 to 37% in 2019. The Seqota Declaration aims for zero stunting by 2030. Mandatory food fortification will prevent neural tube defects and micronutrient deficiencies. The National Food Safety Master Plan will protect consumers and enhance trade. These achievements demonstrate the power of coordinated policy and clinical action. Despite progress, Ethiopia faces significant challenges. Climate change threatens food security, especially in pastoralist regions. Conflict and displacement disrupt livelihoods and nutrition services. The triple burden of malnutrition, undernutrition, micronutrient deficiencies, and emerging overnutrition requires integrated responses. Health system capacity constraints limit coverage of essential nutrition interventions. Addressing these challenges will require innovation, resilience, and commitment from clinicians and policymakers alike. As future Ethiopian physicians, your role is vital in combating malnutrition. Every child you identify and treat, every mother you counsel, every patient you educate, and every health facility you improve contributes to national progress. Your actions help ensure a healthier, more productive population. The fight against malnutrition is not only a public health imperative, it is a moral imperative. Your generation has the knowledge, tools, and policies to prevent history from repeating itself. Vision of Ethiopia's national nutrition strategy is to ensure that all Ethiopians secure adequate nutritional status in a sustainable manner. This is an essential requirement for a healthy and productive life. Clinicians are at the forefront of making this vision a reality, translating policy into practice and empowering communities to thrive. By integrating nutrition into every patient encounter, you help build a foundation for lasting health and development. In summary, nutrition and health are deeply intertwined, shaping the future of Ethiopia. From foundational science to clinical practice and national policy, each element plays a critical role. As clinicians, your commitment to integrating nutrition into patient care, advocating for policy, and addressing cultural and systemic challenges will drive progress. The fight against malnutrition is ongoing, but with knowledge, compassion, and dedication, you can help ensure a healthier, brighter future for all Ethiopians.